their cameras on at all times and will be asked during the roll call to disclose if they have any adults in the room with them over age 18. All right, with that, Sandra?
Good morning. I want to just make a brief announcement that since our last meeting, Commissioner Rachel Chambers has stepped down from the committee and is seeking appointment at the LEX, the Legislation and External Affairs Committee. So wanted to make sure to announce that. Commissioner Baer. Marking absent. Commissioner Burnick. Marking absent. Commissioner Cross.
Here by myself.
Thank you. Commissioner Fernandez.
Here.
Is anyone in the room with you over the age of 18?
No.
Commissioner Designee Swartz.
Here.
Committee Chair Sai.
Here. No one is in the room with me.
Committee Vice Chair Madrigal Weiss.
Here, and no one's in the room with me.
Thank you. We have quorum.
Great. Thank you. Okay, moving to agenda item 2. These are announcements and updates. We'll be following, as mentioned earlier, Bagley-Keene Open Meetings Act for these meetings, but as part of our commitment to public involvement and open governance, similar to our prior meetings, we will be following relaxed use of Robert's rules to allow for more flexibility and provide some more time for comment. Taking this approach goes beyond normal traditional public comment by allowing for more open conversation and engagement. This is consistent with the commitment the commissioners have made to strengthen transparency and accessibility, including two-way communication between the committee and the public. So we welcome that discussion, while at the same time also encouraging everyone to be as succinct as possible, just for the sake of time. Okay, if we could bring up the committee highlights slide at this point. And so as a reminder from prior meetings, we had talked about how we were going to provide some summaries of what's going on in the other committees, just so that each committee has a general sense and some of the context around work happening in those committees, in particular to better inform some of the considerations that we have here in our Program Advisory Committee. And so today, after this meeting, the Budget and Fiscal Advisory Committee will be meeting and will receive presentations on the Commission's expenditure authorization, a new creative services contract, and also an overview of current contracts and grants, which provides a snapshot of ongoing funding activity within the Commission. Then this afternoon, the Legislative and External Affairs Advisory Committee will meet to consider bills the Commission may choose to support or oppose during the 2026 legislative session. The committee will also review, the Legislative and External Affairs Advisory Committee will receive an overview of new creative services contract. And then finally, on April 27th, the Strategic Planning Advisory Committee will review and discuss proposed updates to the 2024 to 2027 BHSOAC strategic plan in order to better align the strategic plan with some of the new BHSA requirements that we've been talking about. There have been discussions with committees, commissioners, and CBH staff about the best way to ensure that commissioners and the public are updated on what each of these committees are accomplishing and discussing during the meetings. And so at the beginning, beginning at the March committee meeting, each committee chair did start giving committee updates in the commission meetings in order to paint a fuller picture of how the committee work relates to the broader commission agenda items. And so hopefully that's providing everyone with some helpful and useful context. Last update is that the full commission will hold its next meeting on Thursday, May 28th in Sacramento. And with that, unless anyone else has any updates, that concludes our announcements. And looks like we can move on. mean, I think we're on the agenda item 3, which is general public comment. Reminder, this time is reserved for comments that are on items that are not on the agenda today. And so with that, let's open it up. Kelly?
Thank you, Chair. I'm just going to go over a couple reminders for people attending. If you'd like live meeting transcription or closed captioning, please activate the closed captioning feature located in the control bar at the top or bottom of your screen. If there are any members of the public using translation technology, please notify the chair, and at least twice the amount of time will be given to you during the public comment period. For members of the public in the room, if you have not already, please use one of the green public comment cards located at the front to indicate you would like to make comment at this item and any other agenda items. Cards can be given to staff located at the front table. Members of the public can also email us public comment to be shared at the future meeting at publiccomment@bhsoac.ca.gov. I will now go over public comment procedures. Once the public comment period for the agenda item starts, we will close the public comment queue, so please make requests to comment at that time. You may request to make public comment by submitting a card, clicking the raise hand icon on your computer or the app, or if calling in by phone, push 9. When it is your turn to comment, I will call you to the podium or unmute your line and announce your name or the last 3 digits of your telephone number. For virtual comments, I will insert the word last comment next to the commenter's name or number to identify the last public comment. Members of the public should be prepared to complete their comments within 3 minutes or less, depending on time constraints. We truly appreciate your understanding with this process. We will begin with in-room comments. When your name is called, please proceed to the podium to make a comment. And Chair, I believe we have no comments in the room. We will now move on to virtual comments. Please make sure you have raised your hand. Chair, currently we have one virtual comment.
Stacy?
Sorry, I'm having.
Good morning, Stacy Haramoto with Remco and Safe Passages. She, her, kanojo are my pronouns. I was trying to figure out who to forward this to. This is just a save the date announcement. It's in May, just 1 week before your commission meeting. It is on Thursday, May 21st, we're going to have a CRDP or California Reducing Disparities Project exposition. So if you want to find out about CDEPs, and actually, if you allow me to share my screen, I could put this flyer up.
Kelly, I don't know if that's...
I was going to say, Stacey, this is Brenda Grealish. Could you email that to us?
Sure, I will do that right now.
Okay, perfect. Thank you.
Sorry. And this is going to be in Sacramento at the Holiday Inn, and it will be, everybody's invited. There's no cost. It's going to be really, I mean, I don't want to make it sound juvenile, but a little bit like a science fair where all the CRDP projects, which there are over 30, will have exhibits around a room and people can just come and talk. So I know a lot of people want to find out about CDEPs or community-defined evidence practices, programs that utilize these practices. And this would be a fun opportunity to see learn all about them and about the CRDP. So I want to cordially invite everyone. And also, I was just hoping, Chair Tsai, that in the announcements that you could at least mention about the CLCC and the CFLC, since they're
Stacy, it sounds like you cut off on that last word you just gave.
Oh,
Oh, it said the host muted me and I thought, oh, maybe they don't want me talking about this. Um, I just thought it would be nice for you to at least say if whatever information, maybe there's no information yet, but whatever information about those,
And I'm
those.
happy to hop in. It is forthcoming, so we are working on that. And what she's talking about is the vote from the March Commission meeting to keep the Client and Family Leadership Committee and the Cultural CLCC, Cultural Competency and, oh gosh, you guys, what is the CLCC, the language or linguistic?
Competence Committee, yeah.
Is it competency?
Cultural and
Thanks, Stacy.
linguistic
Okay.
competence
Cultural and
committee.
linguistic committee. Thank you. Separate, and we're working on getting those committees back together with or established with the chairs and co-chairs and the members. So more to come on that. Thank you.
Next, we have Larissa Owen.
Thank you. I just wanted to mention that at the August 21st, 2025 Budget and Advisory meeting, it was discussed the inclusion of veteran-owned businesses and being included in CBH opportunities. And then it was discussed again in the Program Advisory Committee meeting on December 15th. And it was stated that DVBEs would be included in funding opportunities. And they would make a concerted effort to include DVBEs. In the recent last two TAY 005 and MBH 002, it was indicated that the RFPs did not include DVBE participation. And in the innovation recent RFP, it stated that there are no DVBE participation goals in the grant and that other contracts would have DVBE participation, of which we have not seen.
Thank you.
all right, noted. Thank you, Larissa. Kelly, any other public comments?
No, we have no further public comments.
Okay, great. So we'll take note of those comments. Thank you very much, everyone. We'll move on to agenda item 4. This is a review of the meeting minutes from the Program Advisory Committee that we had back in February 19th. At this time, I'd like to invite committee members to offer any comments or questions they may have. Looks like no comments or questions from our committee members. I think with that, Callie, please open it up to the public in case there's any comments or questions regarding our meeting minutes from February.
Thank you, Chair. At this time, members of the public may request to make a public comment on this item by clicking the raised hand button on your computer or app, or if calling in by phone by pushing 9. If you're in person, please make sure you have returned in your public comment card to staff at the front table. We will begin with in-room comments. When your name is called, please proceed to the podium to make comment. Chair, currently we have no comments in the room and no comments virtually.
Okay. Moving on. Thank you, Kelly. I think Sandra.
We'll need a motion that the
I'll
Program
motion.
Advisory Committee. Thank you, Commissioner Madrigal-White. Do I have a second?
Second.
Thank you, Commissioner Sai. So we have a motion and a second for the Program Advisory Committee to approve the February 19th PAC meeting minutes. Can I have the motion on the screen?
Apologies, I don't have a motion slide on the presentation.
That's fine. That's the Program Advisory Committee approved the February 19th, 2026 PAC meeting minutes. Commissioner Bear. Marking absent. Commissioner Burnett.
Yes,
Oh.
sorry.
Okay, great. Thank you. Commissioner Bernick. Marking absent. Commissioner Cross.
Yes.
Commissioner Fernandez.
Aye.
Commissioner Designee Swartz.
Aye.
Commissioner Sai.
Aye.
Commissioner Madrigal Weiss.
Aye.
The minutes are approved.
Great, thank you, Sandra. Okay, moving on swiftly. Agenda item 5. We'll be hearing from Melissa Martin-Mullard, Acting Deputy Director of Research, Evaluation, and Programs, as well as from Callie Clark, Acting Assistant Deputy Director of Research, Evaluation, and Programs, about the Commission's current Mental Health Wellness Act portfolio. This includes options for investing the previously approved $10 million in mental health Wellness Act funds to support full service partnerships. And then at the end of this presentation and discussion, we'll take a procedural vote on whether this committee wants to move the agenda forward to the full commission for consideration. So with that, Melissa and Callie.
Thank you, Chair Sai. So this presentation is in 2 parts. I'm going to kick us off with just a reminder of our current Mental Health Wellness Act portfolio, and then we'll turn it over to Callie to describe a opportunity to reaffirm a commission vote from several months ago related to $10 million for Mental Health Wellness Act funding. But first, just to provide a quick overview. So, established by Senate Bill 82, Governor Jerry Brown signed the investment in the Mental Health Wellness Act into law in June 2013. It provides grant funds to improve access to and capacity for behavioral health crisis services, including crisis intervention, stabilization, treatment, rehabilitative services, and mobile crisis support teams. The Commission actually started the use of SB 82 funds through our triage grant program, and then more recently, after that sunsetted, the Commission identified 6 different areas of focus for funding, and we now have multiple programs in various stages of development, funding, and build out. So I'm going to just walk through and provide a quick overview over the next 10 minutes of our current Mental Health Wellness Act portfolio. So first up, we have our empath projects. So empath units streamline emergency department assessment of the health needs of mental health consumers and quickly transitions them out of emergency departments into a calming space that allows for the rapid assessment, support of behavioral health needs, and linkage to other services. Research indicates that the empath model can result in a 70 to 80% reduction in transfers from EDs to locked psychiatric hospital facilities. The research also indicates that empath units can reduce costs, enhance recovery, and improve outcomes. So our investment in empath units is $20 million across 10 grantees. We have a contractor who provides TA, that's our MACE contractor. The project is currently well into implementation. We have several units who are planning their ribbon cutting in the next couple of months. A couple of units have already completed a soft launch. So these are moving along, and it's really exciting to see the progress and that these units are starting to open. Next in our portfolio, we have a project related to older adults. And so these are our PEARLS and age-wise projects. So PEARLS stands for Program to Encourage Active, Rewarding Lives, and is a brief, time-limited, and participant-driven program developed by the University of Washington that educates older adults about depression and helps them develop the skills they need for self-sufficiency and more active lives. AgeWise is a traditional mental health program for the high-risk and underserved older adult population developed by the County of San Bernardino. Its goal is to help individuals, families, and agencies maintain the best possible behavioral and physical health to promote independent living and well-being. So for our older adult, Pearls, and age-wise projects. We also have a $20 million investment with 11 grantees across the state. This is our next grant portfolio that is scheduled to sunset, and that's at the end of this fiscal year, June 30th of 2026. All right, next we have our SUD, substance use disorder pilot. The purpose of this project is to address the opioid and fentanyl overdose epidemic in California. These pilots will improve access to medications for addiction treatment, or MAT, by identifying and removing barriers within a financially sustainable model. The pilot is conducted in 3 counties representing small, medium, and large populations across the state. So this investment is also $20 million. Again, the 3 grantees are LA, Marin, and Nevada. And we also are contracting with a project coordinator, TA support, and evaluation. And I'll pause here to just invite Chair Tsai to make a comment on this project.
Yeah, thank you, Melissa. And this is more just in the spirit of transparency. I just want to remind everyone that the Los Angeles County Department of Public Health's Bureau of Substance Abuse Prevention and Control is one of the 3 county grantees for this project. I'm the director of that bureau, and so I wanted to acknowledge that fact for the record. We're not making any decisions here, so this is more just in the spirit of transparency. So with that, Melissa, was this the last slide?
There's just 2 more projects before we transition to Callie's portion of the presentation.
Got it. All right, thanks.
Okay. So our next project, which we launched last year, is our 0 to 5 maternal behavioral health project. So this initiative addresses maternal health and early childhood behavioral health crisis through partnership-based approach. We have invested $20 million across 6 core partners who then have, it's a hub and spoke kind of model where the core partners also work with multiple providers to make sure that mothers and young children are able to get the supports that they need across the continuum. So we're pretty early in project launch for this one, but are really excited to have TA support from both the Public Health Institute and UCSF. Our next project is our peer respite project, which is still in the planning phase. So we will invest $20 million across 2 phases. The first phase is a planning phase to launch peer respites, and then the next phase 2 is around tailored funding and continued learning to support the peer respites under this grant award. So this one has yet to be launched, but we're planning on, in the next couple of months, being able to release that RFP. Okay. The last project that I want to just mention is our FSP performance management project. And just to provide some context, the Commission approved $20 million of Mental Health Wellness Act funds to go towards projects related to supporting full service partnerships. We decided to formulate a project around performance management for $10 million. And this has been approved and has launched. We're working with third sector capital partners to provide TA to between 15 and 40 FSP providers across 8 counties. So I think we're just about to finalize the contract for this. So the project is about to launch. At that time that we talked with the full commission about the projects under, or the projects related to FSPs, we said we would come back with a plan for the rest of the 20 million. So with that, so I just want to differentiate between the 10 million that we've already, sorry, let me switch to the next slide. The 10 million the commission has already approved for performance management, where we have this contract with third sector, differentiate that from what I'm going to now turn to Callie to provide an overview for, which is essentially a plan for spending the other 10 million still related to full service partnerships. So with that, I'll turn it over to my colleague, Callie Clark.
Thank you so much, Melissa. So as Melissa just explained, our total investment that the Commission approved was 20 million to use towards improving full service partnerships. We have presented a plan and started a project for the first 10 million of those. We have the second $10 million that we're coming back to discuss right now. So I'm going to go over some information about how we've developed our the game plan for full service partnerships and to share with you currently where we are. So as we get ready to formulate our next phase of this project, I thought it would be important to take a step back and share with everyone how we get to some of these decisions. So a lot of times what happens is the Commission will approve the money, and then maybe a year later we come back and we say we have a plan. And so we thought we would kind of explain to you what happens in that year. So we do have engagement strategies here at the Commission that take us from that initial idea to the release of the RFP. And I'm just going to briefly go through what that can look like. The first slide that I'm going to share with you is a more generic overview of what the process could look like. And then for each project, it's customized. But typically what happens is we have multiple phases. And in the first phase, we would do key informant interviews and targeted outreach. And this could include talking to individuals such as behavioral health directors, peer leaders, state agency staff, and then we would build off of that in what's called a snowball effort and then take their recommendations, talk to additional individuals. It could include advocacy organizations, service providers, and other partner orgs. And those individuals will bring to us and bubble up what they feel are the main areas of focus or the biggest challenges and opportunities that they see in the landscape. And then we usually, following on that, open it up to the community so that we can bring in and center lived experience. So that could look like community forums or focus groups. And then from that, we'll take the information that we've gathered from those first two phases, and we may then at that point do some additional analysis, either in the form of survey or quantitative and qualitative analysis. And so we could, for instance, field a survey to a targeted group that came up from our first two phases. It could say, you know what, we really need to better understand the experiences of clients and families. We really need to understand the experiences of service providers, et cetera. And so we might field a survey to better do that. We also will leverage our internal data capacity with our internal data warehouse and bring those data together. And then from those three phases, we will come together with some initial ideas. And then what we will do is take those initial ideas. Here's what we've heard from individuals in the field, from our community, from our data analysis, and we bring those three things together, and then we'll say, here's what's bubbled up for us, and we'll share that internally and externally with some small groups to see how they respond to it. Do they find that it holds? What kind of feedback do they have? And that's a very important phase, because that's where someone can say, actually, I think X, Y, and Z, and give us a reframing or help us understand something better. When we feel, yes, like we have a really good idea of a way, potential way that an investment could be used to best support an initial initiative, we'll work towards developing the RFP. And that's when we'll come back to the Commission and say, here's how we've decided, here's the buckets that we've decided, here's the focus that we are suggesting for the Commission to take. And at that point, that's when the public feedback process would happen, and commissioners would vote either to move forward with the RFP based on the engagement process or give us additional feedback at that point. Then after that, we release the RFP and we go through our standard process where individuals can apply, and then we select grantees or contractors.
We are not getting audio if someone's speaking.
Hear me now?
There.
Side?
Yes, now we can hear you. Yeah.
Okay. Do you mind telling me when you last heard me speak?
Pretty much as soon as this slide came up, then the audio stopped.
Thank you so much. I'll redo this slide. So for FSPs, what this looked like particularly, we held public hearings, we did focus groups, listening sessions, key informant interviews. We did our own internal research. We actually went and did site visits at both adult and child FSPs. We fielded a statewide survey to service providers, and then we did deep dives into county contract processes. From all of this work, which did take about 9 months, we came away with 4 main areas of potential focus for how we could best support FSPs. So out of that $20 million, in February of 2024, the Commission approved setting those money aside to focus on 4 aspects. One was sustainable funding. And so this could look like restructuring current funding models, such as outcome-based contracting, and also the earlier step that's necessary to get there, which is performance management. We also had workforce and capabilities, so supporting workforce development solutions. Accountability, so helping define what success looks like for an FSP, developing metrics, and identifying client outcomes, and to improve the data collection and standardize reporting statewide. And then infrastructure, which is really strengthening the current service delivery models and connecting them to the broader continuum of care. Based on those 4 buckets, we have made some headway in some of them. So I'm going to go through those 4 buckets and tell you where we have made headway and where there's still opportunity for us with the second set of $10 million. So with regards to sustainable funding and outcome-based contracting, we do currently are in the process of launching our performance management project, which will serve anywhere from 8 to 15 counties and up to 40 FSP providers. That will help them internally build the capacity to track, set goals, report data in a way that's of better use to counties and ultimately clients. Out of that, we hope to have a chapter in our 2020, what year are we? 2028 report to the legislature, how to do math, and where we can focus on the outcomes of those learnings. Currently for Workforce Solutions, we have not pursued that aspect of FSPs yet, so there is opportunity there. We're thinking alignment with peer support models potentially. Accountability and data, we focused on that heavily in our last report to the legislator, our 2024 report to the legislator, where we identified areas that are currently lacking in the data collection and reporting system. Infrastructure and service models, we do have a real strong opportunity here with the passing of Prop 1 to look at how we could better integrate SUD services. This is something that came up as a priority for our service providers when we did our last engagement efforts. And so that is still an area of opportunity for us. And then also better understanding how we can integrate and leverage existing and future housing supports. So some goals with our future $10 million is to support the aims of the BHSA by focusing on improving county programs, to invest in areas that reflect the Commission's strategic plan, and also invest in areas currently undeveloped in the last portfolio. So that would be the workforce and the service models focus areas that still have areas for opportunity for us. And with that, I'm going to pass it back to Melissa.
Thank you, Callie. So our recommendation and what we'd like to generate some discussion around and hear questions from our committee members, but we suggest releasing 1 or more requests for applications to invest in FSPs that could look like local assistance dollars, TA contracts, and potentially some research and learning contracts focused on the following categories. So under infrastructure, we have identified a need to better understand standard of care, SUD, and housing. So under standard of care, there's a need to identify and document common patterns in FSP service delivery that affect care quality. For SUD, conducting a landscape analysis to identify strengths, gaps, barriers, and opportunities in integrating SUD treatment into FSPs / having freestanding or FSPs that serve only those with an SUD diagnosis. And then for housing, to examine and document how housing placement decisions are made for individuals served in FSPs, including the factors, constraints, and service considerations that influence housing stability. And then under workforce, as Kelly indicated, we see an opportunity to look at how peers can support current workforce challenges, specifically within FSPs. So this could look like local assistance, technical assistance, and research. So before we go to the motion, I'll just pause there and invite questions, comments, discussion from first our committee members.
Thank you, Melissa. So we'll go to the committee members first. Comments, questions?
We have one question in the room here.
Good morning. Marjorie Swartz here in the room, Commissioner. I had a couple questions. When you talk about, you've already done some outreach, it sounds like, and surveying, but one of the slides talks about additional, and I was wondering if you could elaborate a little more on the difference between, there were two different boxes there. The difference between key informant interviews and survey analysis. If you could elaborate a little bit more about who are or how the difference between those. And then I also was hoping you could go into local assistance a little more and explain what you mean by that. Thank you.
Sure. So, and I do also want to say that although I presented phases today for the engagement, depending upon the project, they could actually happen in different orders or they could be iterative. So I just want to be really clear about that. But key informant interviews sometimes can happen either at the very beginning of a project, like they did with our FSPs, where we are identifying individuals who we believe have an understanding of what's happening in the landscape and we go talk to them. So if we want to find out what are some ways that we can help improve FSPs, we might go talk to county behavioral health directors and just sit down and listen to them. What are they seeing? We might identify some partner organizations that we feel have a pulse on that and go talk to them. That helps bring up what other people who have eyes that we don't have on the ground are seeing, right? And then from that information, we'll bring that together with other sources such as community forums where we might have an opening listening session and hear from the public. And then we might say, okay, we keep hearing about, let's say, workforce shortages. This keeps coming up. We really need to understand that a lot more. So let's go do a survey of service providers and ask them some key questions around, for instance, what's your caseload? What's a wait time to get a position filled? It really is a deeper unpacking of a topic that's bubbled up. So that's where those two things come into play. Now, we may get our survey data back and say, oh, wow, all right, so we see that positions aren't being filled for a really long time. Well, guess what? Now we got to go back and do some more interviews. And now we have to go back and talk to individuals in administrative positions who can explain to us why positions are staying open for so long. Is it nobody's interested? Is it salaries aren't high enough? Is it that there's just too much turnover? They don't have resources to get through hiring? right? So it is a little bit of an iterative process, but if you could think of it, the interviews help us do the qualitative part, the listening and really getting a deep, rich understanding in words. And then the survey part helps us kind of break that down and into some numbers that we can then take to inform the two things together.
Can I just chime in to also just note that the Commission supported a multi-county collaborative for FSPs to kind of provide technical assistance and capacity building. Through that multi-county collaborative, we were able to get information through kind of a key informant interview process to better understand the needs for counties and providers on the ground, and then just iterated from there and had our TA provider field a statewide survey. So that went out to counties and providers around what exactly are the technical assistance and capacity building needs that you have. So it was through that, the results of that statewide survey, that we identified the 4 buckets of, I don't have the slide up, the workforce, infrastructure, accountability, and sustainability.
Okay, great. Commissioner Schwartz, any follow-up, or does that address your question?
I do, but I don't want to monopolize the conversation. So I'll pass to someone else unless there are no other comments or questions.
Anyone else? Otherwise, we can go back to Commissioner Schwartz. Seeing none?
I just had a few follow-up comments. My understanding is that recently the counties were required to submit their integrated plans. And so hopefully you can look at the intersection of the full service partnerships, especially how they are including SUDs, since that's one of the newer aspects of the behavioral health funding. That was one comment I had. I think that's I know, I'm sorry. The other, probably all the staff and commissioners already know this, but I recently had a light bulb moment to discover how much the counties were reliant on contracting out, that most of the providers are not actually county staff. And so I just think, am hoping that you focus on that aspect as well to discover when you talk about workforce, that you're looking at the contracting capacity and what the issues are with contracting out for service providers for the full service partnerships.
No, go ahead.
Thank you so much. One, your comment around integrated plans is very timely. So we do plan to do just that. And then two, as far as contracting goes, you also are right on the money. So we have done a deep dive into county contracting processes, and some of those findings were in a report that I'll be happy to send your way that we put out in 2024. And that actually work, going in and doing those deep dive into the county contracting processes, is what informed our current project for the performance management, and ultimately hoping to get counties to a place where they can decide if outcome-based contracting is the best way for them. So I will make sure that I send that to you, and hopefully you'll find that very interesting.
Thank you. That's all I have.
Thank you, Commissioner. Any other comments or questions on this item? I do have one comment on the landscape assessment. I think it was on one of the last slides on the substance use section. I don't know if you're able to pull that slide up. And this is kind of general feedback that I will consistently give in all the different groups that I'm in, is kind of encouragement for us to look at what prior landscape assessments have been done elsewhere to help inform, because especially if we're going to be using resources in order to do a landscape assessment, because at this point, there's so many things that we've looked at across behavioral health systems, both mental health and substance use. It's rare to have a focus area where there isn't some kind of a prior analysis that's been done. I know on the substance use side, looking at strengths, gaps, barriers, opportunities, I think that there have been some prior reports, one from CHCF that I'm aware of. They may not cover this exactly in terms of FSPs, but FSPs are also a kind of outreach and kind of wraparound service, right? And so I think there are still things that we can take away from prior landscape analyses. So that's my main comment. But thank you. This is very helpful.
Thank
And
you.
unless anyone else on the in terms of commissioners has any comments, we can move on to public comment. Okay. Kelly, you want to open it up to public comment?
Absolutely. All right. At this time, members of the public may request to make a public comment on the agenda item by clicking the raised hand button on your computer or the app, or if calling in by phone, by pushing *9. If you are in person, please make sure you have turned in your public comment card to staff at the front table. We will begin with in-room comments. I see no comments in the room. We will then move on to virtual comments. Right now we have one comment, which is Stacy Hiramoto. Stacy, please go ahead.
Hi, Stacy Hiramoto with Remco and Safe Passages. Thank you for the nice presentation on the FSPs. I don't want to make any assumptions because I know you all are committed to this, but I didn't see anything in the goals or some of the descriptions regarding ensuring equity or reducing disparities. Ever since FSPs came into being, they have, at least at the beginning, they did not serve BIPOC or BIPOC communities in the numbers that they should, at least statistically. Also, many counties, and I know this is, a long time ago, like 2010 or whatever, but some of the counties weren't collecting information on gender identity and sexual orientation, so we don't know. And I'm hoping that things got better. So I was hoping, and again, I know this is a big overview, and I know the commission is dedicated to equity. So I hope, like in maybe some more detailed, granular goals and objectives, you have language about that at least. I do really support spending more time with SUD because, again, this is something new for Prop 1. And the last thing is I totally support, Remco totally supports the interest in peer workers, but also I think you should consider checking into community health workers because for BIPOC and LGBTQ communities, community health workers are very effective, and many organizations that specialize in serving BIPOC or LGBTQ communities utilize community health workers. Thank you.
I just want to make one comment. Thank you so much, Stacy, for that reminder that while ensuring equity and reducing disparities is a principle and value that we try to have cut through all of our work, it is important to really make it explicit in how that's reflected in our grant portfolio projects. So really appreciate that feedback. I also just wanted to note that another strand of our work around FSPs that we've alluded to are our reports to the legislature. And we're statutorily mandated to describe who is getting served by FSPs and who may be eligible and appropriate for FSPs who aren't receiving those services. So our next report is due in November of this year. We've started doing the analysis and really looking through that equity lens about who's getting served and who may be eligible and not accessing services. So just wanted to make that comment.
Thank you.
Great, thank you, Melissa. Thank you, Stacy. Callie, any other public comments on this item?
I see no other public comments at this time.
Okay, great. So seeing no other committee member or public comments, I think we can take a roll call procedural vote for the Program Advisory Committee to recommend moving this forward to the full commission. Just a reminder that our committee is advisory in nature, so per Bagley-Keene, we cannot and are not taking any actions. Therefore, this vote is not a motion, but more of a symbolic and procedural agreement that we collectively support using this decision-making framework and advancing this to the broader commission. So with that, I would entertain a PAC committee recommendation vote according to what's on the screen here, that the PAC recommend the full commission reaffirm its existing commitment to use 10 million of Mental Health Wellness Act funds to support technical assistance, grants, and research related to full service partnerships in the areas of infrastructure and workforce. Do we have a motion to move this forward?
I'll make the motion.
I second the motion.
Great, thank you.
We have a motion and a second for Madrigal Weiss moving and Commissioner Fernandez seconding. The motion is on the screen. I will now call roll call vote, and I ask commissioners to unmute their lines to help with the process. Commissioner Bear. Marking absent. Commissioner Bernick. Marking absent. Commissioner Cross.
Aye.
Commissioner Fernandez.
Aye.
Commissioner Designee Swartz.
Aye.
Commissioner Sai.
Aye.
Commissioner Madrigal Weiss.
Aye.
The motion passes.
Great, thank you, Sandra. All right, thank you, everyone. And then we can move on to our next agenda item is just really adjournment. Kind of have gone through this meeting in record fashion.
I have to say, actually, there's just a next step slide. There's one more slide after this one. And sorry about that, Dr. Sai.
Got it. Okay, great.
Thanks. So now that the motion has passed, we wanted to present with you some of our next steps. So at this point, what we would do is develop and implement a stakeholder engagement plan. So considering all of those steps that we did before and how we can now draft an engagement plan to highlight what's important to the community and individuals in the development of the actual RFP, RFA. And so then we will present the outline of that back here to PAC and then to the full commission. We will release, we are anticipating and hoping to make a January 2027 release with an announcement in March of next year. And we anticipate executing contracts by July 1st of next year.
Great, thank you. Assuming no comments or questions on that item, I think we can move on to the next agenda item, which is adjournment. Just want to thank everyone for participating today. Sincere thanks to the CBH team, as well as members of the public and our staff. Our next full commission meeting is May 28th. As a reminder, in Sacramento with a virtual option available for stakeholders. There'll be more information on that posted online in the coming weeks. And then our next Program Advisory Committee meeting is on June 18th. And the time for that will be announced soon. So with that, we'll adjourn. Thank you, everyone. Have a great day.
Thank you.